Hi, I'm Dan Scuff, and I'm Chief Solutions Officer for the Cognizant Microsoft Business Group. And I am so excited to welcome you to Ignite, but also to introduce you to Cognizant's new Microsoft Business Group. Cognizant's made a significant investment into the Microsoft ecosystem with the acquisitions of New Signature and 10th Magnitude to form the foundation of this new business group. And we focus on three things: focus, simplicity, and scale. We are 100% focused on the Microsoft ecosystem and helping organizations to take advantage of the breadth and depth of capabilities on the Microsoft stack. Second, we're focused on simplicity. How can we help organizations leverage all of the out-of-the-box capabilities across the Microsoft cloud and bring those together with our unique Go digital operating model? And the final thing we're focused on is scale. How can we bring together the best of resources local to the organization and couple that with a global delivery network of associates based around the world? So this morning, I'm really excited to introduce you to a couple of my colleagues, Stephen McQueen and Sam Lloyd, to share an incredible story about how one of our customers, Public Health England, weathered what has been the most critical challenge that we have all faced in a generation. So, Stephen, can I ask you to introduce yourself?
Hi, I'm Stephen McQueen. I'm the Business Development Director at the Microsoft Business Group for Cognizant.
And Sam?
Hi, I'm Sam Lloyd. I'm Head of Technology for Public Health England.
So we have viewers, Sam, from around the world joining us today. Maybe you could just spend a minute telling us a little bit about what PHE does and how you've been involved in this COVID response.
So PHE is the UK's expert public health organisation. We're an executive agency of the Department of Health with the responsibility to protect the UK population from threats. We do that with world-leading science, research, knowledge and intelligence. When the COVID incident hit, we were really in the eye of the storm, and it had very significant implications for the whole organisation in terms of priorities, structure, resourcing, etc. And obviously from a technology from my perspective as head of the technology function, we had to adapt very quickly to support that, and technology quickly became critical to the overall response.
I think I'll start off, Sam. I wanted to start off by trying to give some context of your journey to the cloud. As we met back some time ago to discuss how we might help PHE get the most out of Microsoft offering, that's over nearly 2 years ago. And after a few engagements, we helped you position the Microsoft Cloud benefits to the organizations. We started to engage deploying the foundational elements around clouds. And in fact, it was back in January of last year, and I can remember this quite clearly. I remember being on a call with you and Microsoft to discuss how we would best deploy the landing zone for Azure. That you mentioned that COVID could potentially have an impact on delivery and impact on the organizational priorities. At that time, I didn't quite appreciate what the impact was going to have. But what I'd like to sort of discuss first is how you came to that position of taking Microsoft as the technology platform, and then we can talk about what that meant when it came to COVID.
Yeah, thanks, Stephen. So Microsoft technologies have been a cornerstone of PHE's capability since our inception, really. And we've been working on a strategy to increase mobility and flexibility across the organization for some time. We did already have a business case written for the deployment of Office 365 across the organization. And as you say, we were working on an Azure landing zone. So this was absolutely the direction of travel that we've been planning to take for some time.
So just how important was it? So when we were talking back in January about how we were going to do those foundational elements, how important was it to get that right from a design perspective? Because obviously, as we went into COVID, you were able to deploy very quickly because you had those foundational elements, up front, correctly done. They'd been designed and they were being deployed in the right way. And sort of, if we look at landing zone, we've worked very extensively on you on that landing on getting that design right up front so you could deploy quickly.
Yeah, I think we had two key objectives, really. One was to make sure that the user experience was taken seriously in the deployment, and the other was to make sure that security was at the forefront of our thinking. My view is that getting the user experience right is absolutely critical to the success of any technology project, because ultimately it's how your customers receive it, which determines the success of it. So we put a lot of planning and thinking into that up front. And secondly, security is really fundamental to PHE. We are a processor of large volumes of patient identifiable information and other very sensitive data. So really, we can't afford to take any chances with that. So building a security design into the Microsoft platforms from day one was absolutely critical. So having considered those things from the outset stood us in really good stead when we came to do the deployment.
So just going back to when COVID first emerged and we were heading into March and the first lockdown, and the organisation had to adapt and change to COVID. What did that actually mean to you and your organisation and your staff?
So it impacted us in a number of key ways. The first point is that PHE was instrumental in the UK's initial response to COVID. So that required some organisational changes, such as establishing a network of incident cells, which were focused on responding to specific aspects of the incident. The other was the organisation needed to scale up quickly because that activity required extra resources. Of course, we were impacted by the lockdown in the same way that everybody else was. So PHE went from an organisation which was about 80% premise-based and 20% remote to completely the other way around, for 20% premise-based and 80% remote. That happened within a matter of days. So we've had to adapt our operating model as a technology function. We've had to change our support structures. We've had to provide capability to a whole raft of new users and customers. We had to increase our remote access capacity. We had to think about how to enable people to connect and work effectively when they're not in the offices and not seeing people on, in the way that they're used to. So the impact was really fundamental.
And obviously you were able to lean into the Microsoft stack of technologies at that point because they had started to be deployed. And what did that mean to you and the organisation rather than having to rely on legacy?
Yeah, so I mean, this is where that preparatory work that we mentioned earlier really started to pay dividends, because we'd done the setup work, we had the business case established, we had the funding streams established, we understood what we were trying to achieve. We were able to mobilise really quickly. And we took the decision very early on in the incident that anything that we accelerated would be strategically consistent with what we were trying to achieve. We weren't going to do ad hoc tactical work that would set us backwards. So being able to accelerate that Microsoft deployment was really important. And we actually deployed teams to the incident cells first off, which was about 900 people in 2 weeks. And then we deployed it to the wider organisation, which was another 6,000 people in a further 5 weeks. And all of that whilst taking into account the security and user experience aspects, which I mentioned earlier. So we were able to give people a properly managed deployment experience and provide them with this additional capability really quickly. And the benefits were recognised immediately. Uptake was really strong.
And just talking through those the business change elements, we helped you deploy the technology, but we also helped you on the business change elements. I mean, what did that mean to the actual end users? Did that have an impact on the uptake?
It did, absolutely. So we set up a network of business champions across the organisation. They worked with yourselves to upskill and make sure that they had access to the right training material. We provided targeted training to every single person within PHE if they wished to take it on. And we're now seeing the team's adoption percentage at 96%. So of all the people who've got teams, 96% of them are actively using it.
Would you say the organisation now is, adopted teams successfully to the point where they just can't do without it?
Completely. So, I can't see a way in which we would be able to operate in the way we are now without teams. It just wouldn't be possible.
Fantastic.
So Sam, I'd love to understand a little bit more about your kind of technology strategy, technology roadmap. I mean, obviously you're big consumers of Microsoft technology. Did you look at other vendors? Are there other parts of your infrastructure that run on different technologies? Just talk to me a little bit about that.
Yeah, so our desktop estate is and always has been largely or mostly Microsoft based. I think that the skill set of our customer base in terms of their sort of daily activities is firmly in the Microsoft space. Choosing Microsoft 365 as the collaboration platform that we wanted to deploy was really the only sensible choice at that point. So that was a decision that made itself really. looking more broadly across the technology landscape, we are invested in a range of different platforms and technology approaches. So we use some software as a service tools from a range of suppliers. PHE has quite a big focus on scientific and high performance computing. So we do whole genome sequencing, for example. This is something which is coming to the fore through COVID as well, because obviously it gives us a really important ability to track new variants as they arise and monitor their prevalence across the population. And a lot of that capability is based on open source technologies. So we do use a range of different tools and techniques. We have a significant capability around the Microsoft server space as well. Many of our core business applications are based on SQL and other platforms.
So as we speak to organisations about their journey to the cloud, sometimes those organisations have faced challenges internally from a sort of security standpoint, from information governance standpoint. Is that something that you experienced, and how did you come to overcome those challenges?
Yeah, so we have been on a cloud adoption journey for some time. We haven't. This isn't a undertaking that we've just started through COVID. So we have done some of this preparatory work. But yes, as I said before, security is a really critical consideration for PHE. So we really had to make sure that we'd addressed information governance and cybersecurity concerns. But building on existing risk assessment processes that we have within PHE, and of course working closely with Cognizant to understand the capabilities and the cybersecurity protections that are available within Azure. Working closely with our information governance colleagues and our CIRO, we were able to find a way through those challenges and to get ourselves to a position where we were comfortable to put PHE sensitive information into Azure.
Awesome.
Great. Just if we explore that a little bit. So when you implemented Azure, that was just around the time of COVID. So that came online with the landing zone available to the rest of the organization. Now, can you just talk to me about how that was utilized and why that was utilized?
Yeah, in the fairly early days of the incident, it very quickly became apparent that there were a range of capabilities that needed to be deployed very rapidly. As I mentioned, it changed the operating model within PHE, but it also changed the operating model across the broader sector. So new capabilities, new functions were coming on stream, new relationships or enhanced relationships between central and regional functions, for example, came to the fore. Entirely new services, so the test and trace service and the contact tracing activity that was carried on through that function were all new, and therefore we needed to respond to that and to build new capabilities to support it. So there are a number of examples of that where we were able to use the technologies and capabilities within Azure to deploy those new features and functions and services much more quickly than we would have done with traditional on-premise IT. We were able to build a Power BI dashboard which presented contact tracing and COVID information, such as prevalence of cases and contacts, vaccination information, etc., to local authorities and to directors of public health for their own local contact tracing efforts. And we were able to deploy that in a very short space of time. There were significant information governance questions around that because it is fully identifiable information that we built into it. But going through a very careful security evaluation, assessment and build process, we were able to successfully deploy that. We also built a tool for eligibility checking for isolation payments. So where people are identified through NHS test and trace as needing to isolate because they're a contact of a confirmed case, then they are eligible for a payment, which is then processed through the local authority's benefits office. So we built a tool based on Power Apps, which was able to allow those benefits offices to check that a particular claimant had actually been requested through test and trace to isolate, and that was turned around within 2 weeks, I think, from inception to deployment into production.
So how are these challenges impacting the organisation at this time, and how are you using the technology going forward?
So we've delivered a lot of strategic capability to PHE in a very short space of time, and the adoption figures that we've been monitoring show that clearly. We've got around 50 to 60,000 Teams meetings happening per month at the moment. The adoption statistics for the product are around 96%. So of the users who've had Teams deployed to them, 96% of them are actively using it. I think this is really the start of the journey. We've built an initial capability which we need to continue to improve. So our plans next are to deploy other key packages of the M365 suite, and we've already started to look at Shift and Planner, and some people are using that within PHE. So we'll continue the approach that we've already taken in terms of having a really adoption and user experience focused approach, so that we make sure that people get the best out of the tools and know how to use them properly as they're deployed.
Can you just talk us through how we helped you with that? So just from that Power Apps journey, advisory, working with your team, and out to production.
Yeah, so we worked closely with Cognizant on the design and build of that. You provided resources to us working in a blended team, so we established a very close working relationship between PHE and Cognizant. We effectively became one team for that.
So as we enter into this new digital world, we're seeing a shift in power away from perhaps some of the central functions and the democratization of access to IT services across the rest of the organisation with things like Power Platform and concepts such as citizen development. Is that something that you're now starting to see, Sam, across PHE?
Yes, it is. I think it's still really important to have a resourced and capable central function that can make sure that the right tools and capabilities are deployed, and that they're deployed safely and securely, and and to manage the overall environment and infrastructure. I think taking an enterprise view of your capabilities is really important, and that bit needs to be done centrally, in my opinion. But also, I think we need to be moving more towards a hub and spoke model where there is capability embedded across the business, so that people are able to make use of those tools safely and effectively as widely as possible, so that corporate technology doesn't become a bottleneck in realizing the benefits of that capability.
I mean, we talk a lot about this kind of balance between agility and control, and I think we're starting to see with the cloud that it's all about just having enough control to make sure that everybody stays safe, but making sure that in the process we're not extinguishing that agility that comes from taking advantage of these technologies. So now that you have all of this technology deployed, we're hopefully through the worst of COVID, do you see this having a long-term impact in terms of your operating model, how people work for PHE, what it is that they do for PHE? Talk to us a little bit about that.
I think COVID has forced organisations everywhere to rethink their operating models, actually, and PHE is no different in that regard. I think there are many opportunities, actually, from the new capabilities that have been deployed. I think it is now possible to take a fresh look at how an organisation can function. We don't need to be tied to offices necessarily. We don't need to be tied to particular pieces of kit or devices. I think there is a world of possibility that can be capitalised on. Obviously, there are risks associated with any wholesale change as well, but I do think that all organisations really need to take a step back and think, what do these possibilities mean for them in the future?
So Sam, just going over the last 12 months, could you sum up in a couple of sentences what it's been like for you and your organisation?
COVID has been an incredibly intense period of time, probably more so than most of us have seen in our lifetimes. What I've seen throughout this incident is a great deal of commitment and dedication on the behalf of a great number of very committed and skilled people. And I've seen collaboration both within PHE and across the wider health sector on a scale that I've never seen before. So there are certainly positives to come out of this incident, although it's been incredibly testing for everybody. And I think from a technology perspective, this has really enabled us to take a major step in the right direction, to accelerate some of our strategic ambitions, to see what could be possible in the future. And I really see that as the start of the journey, not the end.
So looking in aggregate, give us a sense of what the sort of macro trends that you're seeing here, what's this enabled now for you as an organisation that you weren't able to do before?
I think there are two key learnings from this incident that we'll be taking forward as we think about our longer term strategy. One is the reduction in reliance on devices and places. I think we really need to be as agile as we possibly can be, and to give people the ability to work in as many different ways and from as many different locations as is necessary, whilst still obviously having security at the forefront of our minds. Those challenges that we mentioned about, reliance on remote access, reliance on some of our on-premise services like Skype for Business, reliance on the provision of laptops to new starters, all of those things were constraints. So if we can reduce our reliance on those kind of physical infrastructure aspects, then we'll be much more agile in the future. It will give us the ability to build surge capacity when we need to. So that's one key learning. And the second one, I think, is reduction of time to market in terms of deployment of new capabilities. We learned through COVID that when it's necessary, we really can deploy significant new capabilities quickly, but do it properly and securely as well. And I think that's one of the key capabilities that the Azure stack has given us. And obviously, we need to take both of those forward as we start planning longer term for the National Institute for Health Protection.
So if you were talking to any of your peers out there that are still, sort of thinking about this, still not sure whether this is the right thing to do, what would be your parting words of wisdom, your advice to everybody sat around the world watching you today about, how you can really take advantage of the cloud to become, a more digital organisation?
I think for me, COVID and the response to it has really focused my mind on the fact that cloud is not an option anymore. I think in order to have a modern, agile, responsive, scalable, functioning organization, we really need to have a significant investment in cloud capability. I just don't see that it's possible to do it in another way at the moment.
So Sam, just thinking about the future, what does that mean for you and your team and the organization moving forward?
So COVID was hopefully a once in a generational incident. It has major ramifications for the entire health sector. That includes Public Health England. Our focus is increasingly turning to the formation of the National Institute for Health Protection, which is a new agency that will be formed in October to really have that laser focus on health protection. Many of the strategic objectives that we've already discussed, I think, will continue to be critical for NIHP. So key areas like mobility, security, agility, building rapid surge capacity, having that foundational cloud capability to build new services quickly and reduce time to market. I think those are all going to be absolutely pertinent for NIHP.
So I'd just like to end by offering a huge thank you to you, Sam. Thank you for joining us today for this session, but more importantly, thank you for your partnership over the past year. It's been an incredibly testing period, as we've all said here today, but we've got through it together, and we've got through it together with that partnership focused on how can we help your organisation to become a more digital endeavour and to take advantage of all of these new technologies. For everybody watching, we hope you've enjoyed it. We hope you enjoy the rest of Ignite. And with that, we bid you farewell.